Well, as we know, autism has been in the research, and we've been talking about individuals with autism for almost 60 years. I mean, it was first diagnosed and written in the scholarly articles from Leo Kanner back in the 1940s. But what's happened in the last 10 years is we've actually looked at the ratio between boys and girls, and we've been trying to figure out why are we seeing this ratio discrepancy of males to females. 4 to 1, so when we look on children or individuals on the spectrum, on the severe end of the spectrum where they're impacted maybe nonverbal or have an intellectual disability, that ratio is 4 to 1. When you move on the spectrum to individuals that are mildly affected by autism, or we might refer to as Asperger syndrome or high functioning, that ratio of males to females is 10 to 1. So there's something happening that is interfering, or pediatricians, doctors, psychologists are not diagnosing at the same rate as they're diagnosing males. They're not diagnosing females. And there are several factors that currently are being discussed, and one of them is the diagnostic tools themselves. There may be a screening tool or a diagnostic instrument that the doctor will use and ask parents, but those questions on that instrument tend to be geared more towards male behavior. So males will automatically score higher, and you need to have a score in order to have a diagnosis of autism spectrum disorders. Females, they present with different types of behaviors and much more subtle than males. And so they fly under the radar. And so their score is not as high and does not provide them with the diagnosis. So we have a 10 to 1 for high functioning and a 4 to 1 for children with more severe autism. And it's not so much the diagnosis that's so important, but that's how you access services. And without an appropriate diagnosis, I don't receive appropriate speech therapy or occupational therapy or behavioral therapy. So one of the recommendations is maybe we would have different gender norms for scoring. Girls may have to score at a certain rate, boys would score at a different rate in order to receive the diagnosis. But that's just kind of preliminary findings at this point. We know that there's no reason at this point why boys and girls wouldn't be a 1-to-1 ratio. Now, another factor that contributes to the discrepancy between males and females is genetics. There has been some very preliminary genetic research suggesting that because the sex chromosomes, boys with XY, girls XX, that having that extra X chromosome actually protects girls from some of the severe symptoms of autism. And so, again, preliminary, but more research is being done looking at those sex chromosomes and how it might impact girls on the spectrum and that ratio of boys to girls. As far as additional references or resources, it's very few. Although as much as we know about autism, when you look at females on the spectrum, there's just a few researchers around the world that are doing this research. The National Autistic Society in the UK has just recently started an initiative looking at women, and they've offered some conferences and training for women on the spectrum and teachers and professionals. Yale University in the United States has just received a grant for studying females on the spectrum, but all of this there's not enough available. I wrote a book 7 years ago called Girls Under the Umbrella of Autism Spectrum Disorder, and the purpose of that goal, the first mission we had, both my co-author and myself, was to give girls and women a voice because they tend to not be represented as heavily as males in the autism community. So we need to be doing more of that type of research and resources available for women on the spectrum to be able to network with other women and receive appropriate adult services as well.